auditory tubes, opening of the
Uh-huh. Remember that comes from the middle ear? So the middle ear cavity has air in it, and you go up or down in the elevation, that changes the pressure between the outside environment and your middle ear, and yawning can help to equalize that pressure.
Is the soft palate under, or part of A, part of the nasal
Part,
sphincter?
it's not part of A so much as it's a site of separation.
It's more of a.
So it divides.
It's in the finger.
All right, then we would have B, which is the oral pharynx. B and C are both a joint passageway for air and for food. And so we need a little bit more protection. So we change our epithelium from pseudostratified columnar to the non-cornified stratified squamous that we see with the map. And kind of at the interface between the oral cavity and the oral pharynx, but still considered to be part of the oral pharynx, we have the palatine tonsils. The lingual tonsils are considered usually to be part of the oral cavity. And then we have the laryngopharynx. And we continue the epithelium of non-cornified stratified squamous.
Isn't the separation for the, between B and C would be the.
That's what I want to go over now.
Oh, I'm
Yeah.
sorry.
So separation, I don't want to write it on the board, but you can diagram it on your thing. So separation from nasopharynx to oropharynx is the level of the hard palate. So again, if you take the soft palate and straighten it up, okay, you would have that space across there. So palate. Separation, so then the oropharynx is defined by the palate to the top of the epiglottis, which is a cartilaginous structure of the larynx or voice box. So since that's a new item for us here, I'll. And then the inferior border is the separation between the division of the pharynx into esophagus and laryngeal open. All right, so if we look at the epithelium again one more time, we have two. Above the palate, we have pseudostratified columnar epithelium, so in the nasal cavity and in the nasopharynx. In addition to this basic structure, we have olfactory epithelium, which is not truly epithelium. It's neurons. So it's the olfactory neurons. Remember where the cribriform plate is located? Part of the ethmoid bone in the midline between the two frontal bones. We have the crista galli. So we have the perpendicular plate extending up like this, forming the crista galli, and extended up through an oval structure that has holes in it. That's the cribriform plate. And so through that, we have the olfactory nerves. And so these olfactory nerves form the olfactory epithelium. Again, it's neural tissue. It's not truly an epithelium. Anybody remember what type of the shape of the neurons from Bio 430? You can see them in the diagram over here. What do we call this? The sensory neuron. Yes. Bipolar.
Oh,
Yeah, we're not
okay.
saying it's, you know,
Like, yes.
hyper and elevated and depressed, but they have two processes. So that was one of the places where we found bipolar. So it's really the neurons and their supportive tissue. It's not a true epithelium, but it's associated with the superior nasal concha. It's posterior to them. And then here's a good picture of respiratory epithelium, in case you forgot. This is a really sharp one because it's made in a plastic medium. Remember the thick basement membrane that pseudostratified columnar epithelia had? The nuclei looked like they were on multiple layers, but in fact, why is it pseudostratified?
Because they're all attached to the basement.
They all attach to the basement membrane, so even this cell up here that has its nucleus is going to have a very thin process that extends down to the basement membrane. We have cilia, which are much taller than microvilli and larger. What's the content of cilia?
Myosin, or microtubules?
Microtubules, and they are modal because they have use ATP to slide past each other, and then we have the goblet cells. All right? You see goblet cells continuing all the way down through until we get to simple cuboidals. The simple columnar will have them as well. So this is what the cilia are doing with the mucus. This is another protective element. In addition to the epithelia, the mucus, the goblet cells secrete a mucus, and then particulate matter that is too fine to be trapped by the hair in your nasal cavity, in the vestibule, will coat the cilia, and it's sticky obviously, and so finer particles that drift down or inhaled into the pharynx and lower respiratory tract get trapped in the mucus, and you notice it has a one-directional primary sweeping movement. We swallow probably 6 to 8 cups of this stuff every day. So we get constantly being moved up, and we're not constantly spitting, so there's only one other direction for it to go. All right, let's look at the muscular structure of the pharynx. We didn't look at these muscles in Bio 430. They're hard to find on our models. Last semester, I opened up, we had a separate head cadaver section, so I'll check on Tuesday, or maybe in the lab again, there's nobody in there, see if we still have that where we opened it up. But it's a series of muscles that form the pharynx, all right? So think of not a completely closed tube for all of it. Some of it, most of it is just maybe 3/4, 2/3 to 3/4. And so it's a series of overlapping muscles. The top one, the middle one overlaps the top one, and the bottom one overlaps the middle one. We did talk about the superior constrictor. I didn't require you to learn it last semester, but if you recall the buccinator, which is your cheek muscle, you suck in your cheeks. The raphe or seam line was formed, where the buccinator had its origin from that raphe, and the superior constrictor, here's a buccinator, and the superior constrictor, and those two kind of shared a common band of connective tissue. So this is skeletal muscle, helping to contract when you swallow. This is a view from Netter's, where part of it's been opened up on this side. So you can see here the superior, middle, and inferior. So I'm going to leave this diagram on the board, and then erase what I have on the board already and kind of diagram this for you. What, without looking at lecture notes, what cranial nerve do you think, or nerve, is going to innervate? Go ahead and take another picture if you want to replace, extend the diagram to under the terms. What nerve or nerves would innervate?
The hypoglossal,
No, that's tongue only.
glossopharyngeal.
Glossopharyngeal for the upper portion, and the lower portion is split and shared by glossopharyngeal and vagus. We tend to think of vagus as just autonomic, especially after the last few weeks. But in the neck area, it also does skeletal. In fact, it is the nerve of speech, as far as the larynx is concerned.
Says it right here.
So this diagram is included on page 11 of your lecture notes as far as a posterior view.
She saw these muscles here that she was referring to. The superior constrictor.
Coroner's office is threatening probably an 80% possibility of taking back our cadavers this year. I'm not quite sure why. We got them in 2006, and it took us over a year to dissect them, and they've been continued to be worked on ever since. They cost us a little over $2,000 a piece, and I had a 50% leave time for 2 semesters to work on them. So there's a lot of resources to just, it was an agreement for 3 years, and then we could continue to use them after that, just sending a letter requesting their use. Next State has some that are even older than that, and whoever somebody has just arbitrarily decided, well, this rule has always been on the books, and we want them back. It's like, well, they're just gonna cremate them and then throw away the ashes or bury them or give them, I don't even know if they have the records of the families still, or the families want them back. New Mexico had a policy when we dissected cadavers with the physical therapy department that they would send the cadavers for a year, the students would dissect them, and then we would send them back, and they would cremate them and give the ashes to the family. But that was never the intent here. And so, I don't know, maybe if we have to, there's one dissection I've always wanted to do with our cadavers that allows this particular view and finding the cranial nerves 9, 10, 11, and 12. And it involves segmenting, cutting, and sizing the ligaments between the occipital bone and the first cervical vertebra, the front and the back. And there is a plane of fascial separation. Don't do this if you have long fingernails because it'll hurt. But mine are relatively long, so I'll just kind of blunt them. But if you take your fingers, and you won't be able, it's going to hurt, so don't do this any farther than you want to. But if you push down behind your trachea, all right, in a cadaver you could actually bring your fingers together and pull the trachea forward and slide your hands up and down. It's just fascia connecting that. Remember the longest colon muscle that I talked about in 430? It's right along the vertebra. That's that plane of separation. So you would separate that back and forth. We've already cut the ligaments from the skull to the first cervical vertebra. Then you can take the head and lift it up and bring it down forward onto the chest. And you have this view on the far left. All right? And you can then find the cranial nerves that are coming out the jugular foramen here and follow them in towards the face. And you see this view, and you can open it up and see the posterior view of the larynx and nasopharynx. So here would be the perpendicular plate. You're seeing the middle and inferior nasal conchae. These 2 spaces would be the, what do we call the posterior openings of the nasal cavity? Internal nares. Okay, so that's the internal nares. Here is the hard palate and the soft palate and uvula. Here are the 2 lingual tonsils. We're looking at this posterior view into the oral cavity, and this is the epiglottis. All right, so we're looking now at the structures of the larynx. So if we look at the superior constrictor, all right, that would be, you'll see the structure on the diagram. It's going to it also has a midline raphe. So there's 2 muscles. Okay, and this is going to have its origin from that raphe with the buccinator. And then we have the middle constrictor, and it's going to have its origin from the hyoid bone. So you can see that on page chin. It's almost like a Christmas tree. All right, so that would be middle constrictor. Where these are all skeletal muscles. So swallowing is a voluntary movement, although it's a reflex. So once we get the food into the oral pharynx, the rest of that is voluntary. So this is what you're seeing here is the the inferior constrictor, but here's the hyoid, all right? And then the next origin is off of the thyroid cartilage, and that's this portion of the larynx right here. Not the thyroid gland, but part of the larynx known as the thyroid cartilage. All of these three constrictors form the skeletal muscle of the pharynx wall. So when we look at sagittal views of the head model, this thin line of skeletal muscle that you see right here are those three portions of the constrictor. They're forming the posterior wall of the pharynx. So innervated by the glossopharyngeal nerve and vagus. All right, let's look at the larynx and then we'll take a break. Can I raise the pharyngeal muscles? You guys hold that. If you want to grab one of the larynx models up there, it might make it easier to follow along as I talk about it.
Oh, you're killing me. I didn't give myself all this hair.
I just finally did it first. You turned around and I was like, thanks, Walker.
Somebody can use the one that's on the front desk if you want.
I've been blessed with too much hair. I keep getting my hair Joe shot.
Since you get in the way, you just grab the autofocus.
Your camera
Okay,
looks like my...
most of the cartilaginous structures of the voice box are made up of hyaline cartilage. Typically, the epiglottis is elastic, and there are smaller parts of other cartilages that are elastic as well, though most textbooks just refer as the rest of the larynx is hyaline, because it primarily is. The purpose of having cartilage in our airway is to save us from using up energy and opening up the airway every time we breathe. Because we'd have to create enough negative pressure to allow the atmospheric pressure to push the air in. And that we can eliminate a lot of that pressure by maintaining an open airway. So the pressure doesn't have to push the airway open as well. The cartilage is also strong enough for muscle to attach to. And we utilize the muscle of the larynx to change speech patterns in intensity and pitch. So there are several structures. Some are paired, some are single. The largest of the cartilaginous structures is the thyroid cartilage that I just mentioned. It forms a U-shaped box, which is open in the back. Right? So we would have the thyroid cartilage side, lateral view, front view, and posterior view. So I want to draw those similar to what you have up here on the screen. There is a prominence here that you can't see, but you can see it when I draw it from the posterior, the lateral view. So that's the laryngeal prominence right there. It's increased in males, sometimes known as the Adam's apple. Especially in men who are changing, going through Chen's reversal sex surgery, they'll have that shaved down, so it's not quite so prominent, the result of testosterone. So let me just label it thyroid cartilage. So it's one piece. The second largest cartilage is also a singular structure. It's smaller in the front than it is in the back. And this is known as the cricoid cartilage. Actually, let me draw it as a different color so it's visible. So in the back, it fills in this space that was opened up because the thyroid cartilage is not closed. All right, so we look at the model, so let's find that again. So this large one here is thyroid, right? Down here is the cricoid, and that becomes high in the back and partially fills in that open gap of the thyroid. sometimes described as a signet ring, like a class ring, except backwards. So the large stone or jewel would be this portion right here. Now there are ligaments that fill in the gap. And then if we add in our hyoid up here, we have ligaments I wonder why they're drawing that in here. All right, and this is known as the thyrohyoid ligament. Sometimes anatomy can be quite logical. And then between the crico and thyroid cartilage, we have cricothyroid ligament. Looking posteriorly, we have 3 pairs of smaller cartilages. How many of you might where the thyroid? So like little swing doors sitting on top of the cricoid cartilage. We have these 2 kind of triangular or pyramidal shaped cartilages known as the arytenoid. And they swing back and forth. So I always remember them because they kind of look like the letter A. So arytenoid or arytenoid. And sitting on top of them is another smaller one. The next 2 both start with the letter C. These are called the corniculates. The other are going to be called the cuneiform. And I remember the corniculates because they look like a little kernel of corn. That's how I differentiate them from the other C. So on the models, they're usually just kind of indicated by a groove at the tip of the arytenoid. None of our models show the next pair, except as a bump under the mucous membrane, and that's the cuneiform. So they actually start down as a long, slender piece of cartilage and then expand. Oh, kind of like this. So on our smaller models, that I'll show you in just a moment on the screen, we can see these as this little bit of a bump in the membrane. There is a membrane that extends from the corniculate up to the epiglottis. And you've probably heard of groups of individuals that have a language where they click. And that clicking noise is thought to do with the vibration of this membrane. Right? So this is the back of the small larynx models. They're in the back there in the green boxes, the ones with the tongue and so on. So here would be this little bump right here is due to the corniculate. This area right here that's covered up with muscle is where the arytenoids are found. And this is that membrane I was talking about. Okay. So it's a fold of mucous membrane from the corniculate or arytenoids up to the epiglottis, and it's called the aryepiglottic membrane because it connects those 2 structures. So see this bump right here? That's the only existence that is caused by, or the only demonstration of these cuneiform cartilages, is this bump. So this first bump right here is due to the corniculate, and these are the cuneiform.
Does the airy epiglottic membrane have another name?
I wouldn't say no, because everything has more than one name, but I'm not aware of. Okay. So here's another view from a diagram. So here's that membrane. Here's the bump